So welcome back, ladies and gentlemen, to the second episode of the Healing Through Mind and Motion podcast, where we explore the relationship of the mind and the body and how they work together so that we can eliminate chronic pain and get back to doing what we love. So I'm your host, Brian Cade, and I am excited to have Dr. Phil Lombardo on the show today. He is a board-certified doctor of physical therapy, vice president of the largest privately owned PT practice in New Jersey, as well as the Movnat Medical Director, Curriculum Director. So I'm excited to have you on. It seems like you guys are really doing something different from what the rest of the industry is doing, and excited to have you here.
Thanks, Brian. I have to say the same thing about you. Just talking about healing through mind and motion. It's kind of sad that that's a new thing or an outlier, but completely makes sense. So I'm really excited to connect over this.
Awesome. Is there anything you'd like to share before we kind of dive in about what you do and how you got here?
Yeah, I mean, the first thing that I always like to tell people, because when they see Movnat and they think about people outdoors and exploring and connecting with nature and working out or just utilizing these skills at the place where they belong, I really think it's important that people realize that that's never who I was. As a kid, my father would occasionally take me hiking for a couple miles or a local place, but nothing significant. And a lot of times people see what I do or what other people do at Movnat who have taken the courses, and they think like, oh, yeah, that's him. He's always been that way, or her. And it's not true. Again, I was a typical three-sport New Jersey varsity athlete. I went on to college and ran track, and I couldn't touch my toes, and my fitness level was mediocre to say the least. And I had some training and some guidance, but really not enough on what it means to move properly. And so just anybody who's out there and thinking, oh, well, that's Brian, that's Phil. Yeah, of course they're like this. Like I encourage them to keep an open mind and think if these ideas are calling to you, feel free to go for it. Because again, it's not just this inclusive group where everyone's always done this and now they're bringing it out. Again, I found Movnat just 8 years ago, and it hasn't changed my entire practice as a doctor, as well as my own personal practice and what I'm doing. And again, the things that I share with people, or the skills, or the different things that I do with my training. Again, they might see that and think that, oh, he's always been that way. But again, I really want to encourage people to keep an open mind and realize, no, this is something that I found that sparked a really big fire within me.
I really appreciate you sharing that. That not to make judgments of like what you see someone doing now, because we have a client that she's been with us 5 years. When she started, she was 70 pounds heavier. She couldn't get up and down off the floor. Like we asked her to, and she's like, this is such a burden to actually get up. And people look at her now, and she's been, like I said, 5 years. She's moving, doing all these things, and be like, I could never do that. I'm like, she was in less good condition than you are starting at now.
Yeah.
So jump in and dive in. Like you never know what shows up.
Yeah.
So I wanted to check, like, what you just founded 8 years ago, and I watched you on Instagram and see you doing everything with your kids. I believe it's your kids jumping around too. I just think that's awesome. How did you come to Movnat, and what is it like? What was that process like for you?
So I'll try to tell it as short as possible, but it's definitely a series of events completely by chance. I was working with a patient, and again, it's important that we talk and convey our identities to our patients, but also listen to them. And he heard my excitement, and he shared with me the Katie Bowman podcast, Movement Matters. And I was listening to that for a few weeks, and she talked about Movnat retreats and different events and the idea of natural movement. And I checked it out, and Brian, it was like all in from that point. Well, I should say, I did hesitate a little bit, and I think everybody has that a little bit. And I was all in mentally, but I kept hesitating to sign up for the certification. Oh, I don't know if I'm ready, all this stuff. And everything went smashingly. Everything was really just left with so much excitement, so much fulfillment, so much really certainty that I'd found something that was important to me and that was missing. And so I took the level 1 certification. A year later, I went back and took the level 2 certification. And then 2 years later, I took the level 3 certification. And so it's just been, and right away, it was so easy to incorporate it into my patient care. Um, you know, it really was a no-brainer. For me, it clicked and it fit. And I really felt um, deeper levels of fulfillment and a deeper level of instinct saying that this is what we should be doing. And again, there's dozens of practitioners. I'm sorry, there's probably hundreds of practitioners around the world that know this and are doing this, and they're incorporating it into their medical treatments. And so we formed, again, fast forward 5 years later to last year, the spring of 2021, and Movnat now. I've been talking to headquarters, and they said, Phil, how do you feel about pulling the trigger on this medical course? And I said, I've been waiting for this phone call for about 2 years. So we put a team together. And again, I've been using it for my own practice. I've been using it for my patients. And now to be able to share it with other clinicians. We've had doctors of physical therapy at the medical courses. We've had athletic trainers. We've had chiropractors. We've had DOs. We've had nurse practitioners. You name it. So it's really nice to see so many people interested in now learning. Because again, for me, I instinctually was able to incorporate Movnat into my medical practice. But for some people, they may feel reluctant, hesitant, unsure, they have questions. And that's the whole point of the course, is to be able to say, great, let's answer all your questions: space, buy-in, support staff, what do you use for what diagnosis, just to get that creativity flowing. Because once you see it, that's it. Like,
Yeah.
it. You can't unsee it. But some people have trouble. That's what I realized. There's always one or two physical therapists at each certification I've either been at or hosted. And so when the idea of giving them more knowledge of how to incorporate it, not just the MoveNat skills, philosophy, language, all that stuff that you get from the course, but now how to also take that into your practice on Monday morning.
Yeah. So you said you were 100% all in as soon as you saw it?
Yeah.
Not maybe physically, but mentally in. Was it for yourself, or did you see for, like, patient care, or was it both?
So
Like,
it was definitely for myself right away. Uh,
okay.
100%. And patient care took a little bit of time. It took a little bit of exploring,
Mhm.
where I was like, can I do this with my patients? Or how will they respond? What will their interest level be? Why would I use it? Because I really wanted to make sure that I wasn't just throwing it in because I liked it, because I saw somebody else doing it. But it's very, very, very important to me that I have reasoning and meaning and precision in each of my treatments. So again, if I'm doing something that's a good idea, that's not good enough for me and for us in our organization. The precision of why we're doing something and the awareness of why we're doing something is very important. So that took a little bit of time for me to kind of develop it and to make sure that it was really what I wanted it to be. But for myself, I was the only guy at CrossFit. I was wearing Earth Runners and talking about efficiency, and I was the only one there. And so that was pretty cool.
Yeah. That's one of the things I love that watching MoveNet practitioners is the efficiency. Like, people are like, "Well, what do you think about these guys?" And, like, they're strong people doing certain movements. Like, Cavadlo brothers, somebody asked me about them, and they're doing pistol squats. And I'm like, "It looks impressive," but watching, Danny, who teaches, or I think he's the head instructor for MoveNet?
Yeah, program director.
Program director, yeah, he'll do the 70-pound kettlebell from the floor, just bring a leg up and stand with it, like the single leg squat, get up, and it looks so effortless.
Yeah.
Um, and so, yeah, just that's one of the things that stands out for me. When you first saw MoveNat and the movements and stuff, what was it that you saw, heard, or felt that you're like, this is it? Like, I want to explore that.
So that's taken me a long time. These interviews are very helpful because like I said, it was almost instinctual. It was just like, yes, this makes sense.
Mm,
I feel it deep down inside of my gut. As a human being, forget about. I can't say it reminded me of anything I learned in school or something along those lines, because it wasn't that. But it was just as I was doing it, said,
Mhm.
this feels good. This feels right. But
Yeah.
fast forward 5, 6, 7, 8 years later, I realize that it comes down to two things. Number one, creativity and
Mhm.
adaptability to be able to work in different environments and to be able to do things differently. So you're
Mhm.
not just doing the same thing. Humans were meant for this. We know this. This is not a theory. Humans were meant for diversity and for um, not doing the same things over and over again. So
Right.
again, if you're going to the gym and you're using a bodybuilding platform, that's no problem, that or programming. If that's what you want to do, totally fine. That's great. Keep in mind, please, that as a human being, your body craves other things, and it craves variability, and it craves things that are new and not and that you're able to explore and you're able to see. Oh, can I do that? Can I not do that? I don't know. We tend to veer away from that, but that's exactly what our bodies want as human beings. So number one was creativity, and just the ability to not do the same thing over and over again. And
Mhm.
then number two is definitely learning, right?
Right.
So how much learning, and there is some, again, we'll use bodybuilding, but you can use any other, you can use yoga. Once you get a certain point, it seems like that's it, and there's no further learning. But the focus on efficiency and adaptability and the ability to learn on different surfaces and the ability to I tell all my patients, basically in summary, I tell my patients, by the end of this activity, I don't want you to be exhausted and tired. I
Mhm.
want this to feel easier.
Yeah.
So if we're just sitting down, standing up, okay, make sure you're using a hip strategy, make sure you're using both the left and the right. You make sure we always talk about tension and relaxation in Movnat. So make sure you're feeling your abdominals actually participating. And by the 15th, 20th, 25th rep, I want you to really feel those abdominals, and I want you to imprint that in your brain so that
Mhm.
I don't care. I mean, I do care if the abdominals get stronger or not, of course, but the
Right.
main benefit, the precision of why am I doing this exercise is so that you say, oh, I get it. I don't care if you get exhausted and you're saying, oh, this feels a slave driver. Again, that's the stereotypical physical therapy. And, just push me until I die, and I feel like I'm dying, then that feels like a good session.
Yeah.
No, I want you to come out of there saying, I never knew I could do that. I never knew I had abs like that. I never knew something, something. To me, that's a good session.
Yeah, I love that. Yeah, I sometimes say it's like your workout or your movement should make you feel stronger and better and more vibrant when you're done, not like you got run over by a truck. And so it's like, how much better do we feel if every day we just felt more vibrant and a little bit more efficient?
Yep.
I want to come back to the precision because you mentioned precision and creativity and variability, which
Yeah.
seem a little bit different, but you also mentioned how you guys are doing it different as physical therapy. And that's one of the things we talked about starting out is like you guys have a completely different model of how you get somebody to work with like in your practice. Can you share a bit about what you guys are doing compared to the norm? Yeah.
Yeah. Yeah. So, the norm, and I think a lot of people have had the experience, and I'm just talking factually. I'm not talking negatively about anyone. But the most of the public's view of physical therapy is that it's a factory. Physical therapists are technicians that perform almost like just protocol, and they, okay, you have a knee problem, you do these 5 exercises, and the person next to you has a knee problem and they're doing the same 5 exercises. And I think that's a lot of the vision of what people get and what people see, unfortunately. Again, it's not everywhere, but that is very, very, very common. There's a lot of corporately owned facilities, and again, they may have the most wonderful people working there, smartest physical therapists, but the systems are just again set up usually more for mass production. And again, what we're doing, I've been very, very fortunate to be working in this organization for 18 years, and my CEO just decided to take a path less traveled, as he likes to say, and see less patients. And when we see less patients, we have more time with them, and that allows them to get better faster. That allows me to really investigate as a medical practitioner. We all know, we've all been to doctors that take time with us and explore, and we feel like they really are there working. They're going to leave no stone unturned to figure out what's going on for us. And again, I like to really set that bar of expectation for each of my patients when I'm working with them, is that they leave knowing that I did. Can I cure everybody? No, of course not. But we have a very, very high success rate because of the amount of time that we spend with patients, because of the precision of our treatment, again, versus just doing a normal protocol kind of style. Um, and because of the connection that we have with our patients. And again, this additionally goes back to talking about the mind-body connection, and going, what does it mean listening to patients and going above and beyond for that?
Yeah.
How to give them resonance versus just reassurance. There's a big difference in between those two. But yeah, being having time with your patients and expecting a higher level. If
Yeah.
you ask any physical therapist, they say, "Yeah, that sounds great. I learned all this stuff. It's a doctoral level degree in school. There's now residency programs and board certifications.
Yeah.
So if you take all those together, again, a doctor of physical therapy should be your primary care practitioner for any movement related disorders. And if they're treating you like a technician, then again, that's just something to be aware of.
Yeah. It seems like you really put a patient-centered approach, you and the CEO, where it's, what does this person in front of me need? What is their movement strategy that we're going to go with versus and I did a video yesterday, like, here's your 5 knee exercises to rehab anything. And it's like, it doesn't work that way. And so I really love that you guys are doing that. You mentioned that one of the things that stands out is that you're the vice president, you're also doing all the Movnat medical training, and that
Yeah.
you're seeing patients every day and getting to work with them. A lot of times I've heard the experience of, like, you go in and it's like one PTA and 6 people running around. How much time do you actually spend one on one with the patient when you get to work with them?
So, obviously it varies during the time of the day and things along those lines. But if I'm, working a 14-hour day and I see between 14 to 20 patients, you do the math on what that is.
Yeah.
Uh, so it's about 1 to 1.5, which I think is the lowest in the industry. I've heard of some, and again, by no means talking negatively, just factually, that I've heard of some practices that, and the first place where I worked scheduled a patient every 15 minutes.
Yeah.
And so, I don't care if you're the greatest physical therapist in the world. There's only so much that you can do within that time. And
Yeah.
so, again, I just count my blessings every day. I've been there 18 years. I have no plans of going anywhere else. And
Mm.
so it's nice to be a part of something that's doing something different. And and again, it's not just setting it up so it's nice. It's also that high bar that we expect of our entire team, of the doctors that we hire. And while they're there on any given day, we expect them to show up and not just fall back into, because they could take that extra time and just squander it. But we really encourage them and we demand of them to really to think, like, this is what's missing in medicine. It's protocols. If this, then that. The studies showed this has a higher effective rate than this. Yes, but what about clinician intuition? What about experience? What about the patient's values? Again, if I tried to introduce natural movement into somebody and they have no desire at all, then I have to figure out what I want to do with them. Oh, this is silly. I feel awkward doing this. Okay, I have to listen to them. That doesn't mean I'm not going to. It doesn't mean I'm just going to change courses and change directions. Maybe I will ultimately. I'm open minded enough to do that. But I have to listen to them first, and I have to be open minded myself, of course.
Mhm. Yeah, I love that. Yeah, just I'm excited because that's one of the things we believe is, like, where's the person at? What do they care about? What
Yeah.
are they willing to do? What's like a boundary that they're like, nope, don't want to go there yet.
Yep.
And so, completely different than the here's your 5 exercises to do with a TheraBand.
Yeah.
Um, so one of the things we see, because is there's like a belief system, especially when a doctor tells you, like, pain management's your only option, or certain percentage of people that have this condition, this is what the outcomes are, and so that starts to be our reality. just to kind of shift some of that, what are some of the stories that maybe their condition was pretty intense or whatever, but you watch them transition and like that transformation story? Would you be willing to share a couple of those and what stood out to you?
Yeah, absolutely. And you summarized it perfectly, because that to me is my biggest
Mm,
like drive and challenge when people say, I can't do that anymore. They told me not to do that.
yeah.
And, they've just kind of, oh, I shouldn't do that. Um, we have a discussion about it. Why? Okay. What was that other clinician, your MD or somebody else talking about? Is
Mm,
it you weren't supposed to do that for 4 weeks after surgery? Okay, I get that. You weren't supposed to do that when you're carrying a heavy weight. Okay, totally, that makes sense. You know, there's a lot of things that are 100% absolutely anatomical, pathophysiologically inappropriate to do,
mhm,
hands down. What we're talking about is, I think what you're talking about is the perception that we get
mhm,
oftentimes, and again, going back to that mind body connection, oftentimes that's built on past traumas or recent traumas that are telling us this is not safe. And we need somebody to hear that. And we need somebody to truly hear us and in how we're feeling and what our body is telling us, and then what our reaction is telling you or the clinician. And
yeah,
so if we can pick up on that and if we can really, really, really intently listen and give them some acknowledgement for what they're going through. Again, not just what do we like to do? What's the number one? Tony Robbins, right? We like to give this this cheerleader. Come on, like if you just dig down inside with you and you give 120%, like I know that you can make this change or you can do this. I know you can do it. Blah blah. And that might work. I'm not saying it
yeah,
doesn't work, but that's not the path that we choose to go down. And by acknowledging what the patient is going through and truly acknowledging it, not just superficially, but
yeah,
acknowledging what they're going through and just reaching out and giving them an offering based on what you're seeing and then sharing some of your education and my knowledge. Oftentimes I see people really opening up and
mhm,
then again, like we're talking about connecting with natural movement and something that feels a little bit more like a sense of accomplishment and a sense of enjoyment as a human being.
right.
Those two things just click together, and that's where I think they get the most, um, just buy-in, and it helps to subtly, again, very, very, very subtly make neurocognitive changes
Yeah,
because that's what we're talking about here. It's not just can they do the movement or can they not. It's how are they reacting? Why are they reacting? And how are we going to change that? Because that's not going to change, the neural connections that they've formed
mhm,
between maybe it's movement and pain, maybe it's pain and self-image, maybe it's um, capability and their identity. Oh, I've
mhm,
always been this, I'm the mother and I always take care of everybody. I can't be injured. Like, this is horrible. This is the worst thing that's ever happened to me. Whoa, whoa, you're never allowed to get injured? Like, what is that about? Like, tell me more. And just for them that you ask a question, right? So I could turn that around. And this
mhm,
reminds me of, let's see, who, maybe Denise. Yeah, so Denise had low back pain and she
mhm,
said, I cannot lift heavy things. I can't rotate. I can't twist. That was her thing. No twisting, no rotating, shutting it down. I said,
yeah,
well, why? Oh, I got to take care of my husband. I got to take care of the grandkids. And I have to do all this stuff. If I get hurt, that's the end of it. Oh, okay, Denise, that totally makes sense. Like, wow, I could see that. That's your role in the family. That's really great. But through starting with ground mobility, we
mhm,
started to do just rolling side to side. She's like, oh, okay, this is okay. Yeah, I can rotate. And then we started to do some half kneeling and rotating in that position. And then we started to do some lunges. And then we started to get into, maybe some more classic Palloff press or just rotations there. And now she's doing medicine ball throws up against the wall. So we've gradually added that in. And I walked through it with her. And anytime she got hurt, I reminded her that I was there and that I was aware of her role with the family. And I said, Denise, I will never let anything take away from your role. I'm going to do everything in my power. And just her knowing that I repeated that back to her and that I was aware of it and that she wasn't the only one having that fear, that I was feeling, again, I won't say that I completely felt the fear with her,
Yeah.
but I had a mutual understanding with her. And so really giving people that kind of acknowledgement. Again, it's not just like, yeah, 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 yep, 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 totally, totally, totally. Yep, I get what you're saying, and moving on, but really asking another question. And again, if you're seeing 4 or 6 patients an hour, I don't think you have time to ask that other
You
question.
say that kind of acknowledgement only happens with space. Like if it's
That's
15 minutes, like, yep, got it, let's do this. Otherwise, they don't get care.
that's right. And
Yeah.
patients just ask, thinking, they come in and maybe they have something in their mindset of what physical therapy is supposed to be, or what what their treatment is supposed to be, and being able to connect with them and say, look, this is, you're right, this helps a lot of people. What you're suggesting, I think, let's just think of a young lady. She's in her late 20s and she injured her low back working out, and she's had several injections, and she just had PRP injections, and she's getting a number of different treatments. And part of me wanted to, again, we always want to be the hero and with the magic cure. And it would have been great if I had a secret mobilization that I could do that made her feel all better, but I didn't. She was very sensitive. She had about 9 months of this back pain, and so she's afraid to move. So
Mhm.
I said, all we're going to do is we're going to gradually start moving more. And we're going to focus on your range, how far you're moving. We're going to focus on your activation. And we started out lying on the table. Again, she's a fully functioning, before this injury, fully functioning, going to CrossFit, working full time, physically demanding job, all this stuff. And we're just starting prone on elbows. Okay, look side to side. Great, no
Mhm.
problem. Up into quadruped. Great, no problem. Back down onto your elbows. Up into quadruped. Back down on your elbows. Just base building,
Yeah.
right? Then from the quadruped position, sure, a little bird dog reaching, really working on her learning where her abdominals and her gluteals are, and to be able to contract them in a way that is safe and comfortable
Mhm.
for her, so that her amygdala isn't, setting off that alarm, right? So that her amygdala isn't going, oh no, this is bad. I'm in danger. Stop, 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 stop.
Mhm.
So if we can allow her frontal cortex to say, "Oh, this is okay. Oh, this is okay. This is okay," and repeat that over and over again, and that's one of the many, many benefits of Movnat for clinicians, is that we have these regressions,
Mhm.
right? Like this is right. I can see your face smiling because you know that it's not just about, okay, this is the answer. Okay, this doesn't work. How about this? How about this? They're all components. It's like
Mhm.
it's like nutrients, right? If you can't eat one thing, you can still get the nutrients from something else.
Yeah, and it's for us, it's like, what is the smallest amount of motion that you can do pain-free?
Correct.
And we explore that so that you can build that base and it expands. And it seems like that confidence building is as big of the process. Like, okay, you don't want to rotate, but can you be on your elbows looking? It's like you're getting rotation, but it's such a small amount of rotation in the spine that
Right.
like, okay, that's safe. Okay,
Yeah.
what's the next layer? How's that safe? Okay, good. I can do that. And it seems like you just build that base and expand what they believe is possible as well.
This is what we need to talk about a little bit more,
Mhm.
is not you and I, but the entire medical community, is what is that? Like, we all know that, right? But there's not a ton of research out there that talks about how, again, patient comfort level, or things along those lines, that really the buy-in really
Yeah.
helps them to. We see it with extreme levels of trauma, right?
Mhm.
Where people have been through something that's obviously very clearly traumatic in their life.
Yeah.
But we don't talk about these micro traumas that we all carry around from childhood. We all carry around, our personal beliefs about ourselves, about when
Mhm.
something happens, uh-oh, here we go again. It's like, what do you mean, here we go again? Wait, what? Where's that coming from? So again, like you said, giving someone a comfortable place to start with regressions and build their confidence,
Mhm.
is we have to acknowledge that that is changing the neural connections in their brain from their amygdala, prefrontal cortex, hippocampus. Like, if someone wants to study more about how to improve patient care, that's what I say. Study neurobiology, neurocognitive biology.
Yeah. Um, that'll be probably an area I have to study a little bit more. It's like mine's been more of a experiential process of
Sure.
seeing how that builds. Like uh, because we're a non-medical approach, people will come in. They're like, "I have nerve pain down my leg." I'm like, "I can't move." It's like, okay, what position feels good right now? Like, is it sitting? Is it lying down? Okay, good. We can get you there, get a little bit of relief, and it's like it's just amazing to watch that confidence build for people. Um,
Exactly.
and so, yeah, with those kind of stories, one, I'm curious, did they say what was going on for the, or did you know what was going on for the 9 months of pain she had? Like, is it just, yeah,
Yeah. Yeah, yeah, absolutely. And again, I don't want to overlook that fact because sometimes we see it as one or the other. Again, that's combined with a clinical diagnosis.
yeah,
And do I ever know with 100% certainty? No, I always make sure that I'm keeping an open mind to what I'm doing. I might have a very strong confidence in the diagnosis and the treatment paradigm that I'm using, but I'm
mhm,
certainly always keeping a open mind. So the woman in her mid to late 20s, she had a herniated disc that was impeding on her lateral facets and her nerve root. And
mhm,
so I really feel that that is all resolved now. I genuinely feel that based on seeing her move, that that is resolved, and what's left is scar tissue and a chronic inflammation and a chronic neurological alarm that's going off. And
mhm,
if we could literally, I mean, not to simplify it, but if she put like a TENS unit on her that area for 24 hours a day, which I would never recommend to a patient, but if they did something along those lines that would distract her body so that we're trying to turn this alarm off, and that's exactly where my treatment paradigm is going. I'm trying to get her to move so she's
mhm,
thinking about what muscles are tense, which muscles are relaxed. She's thinking about, oh, there's my hip. Oh man, whenever I move my hip into extension, I get an anterior pelvic tilt. Okay, I want to stabilize that, move the hip into extension. Oh, now I'm aware of where the hip is.
yeah,
Okay, oh, that alarm hasn't been going off. Oh, great, because if I focus on something else, again, we're increasing that the neural firing for that area in the cortex, and we're also, the most simplified way to explain it is right the ones that fire together wire together, right? So
yeah,
those nerves are going to start to work together in a positive way versus staying and connecting to that alarm going off. So we
mhm,
have to, you have to think about both the anatomical, physical bones, ligaments, tendons, and things along those lines, but also the neurological system. I feel like it just gets left behind all the time. Unless it's a foot drop or a something motor neuron that we can see very easily, the other aspects of it get pushed aside.
it's like we spend a lot of time in science and research, like pulling away all the parts. Like you've got
Yeah.
your just muscular system, you got your nervous system, but it's like how do they interact? And then even this, like the fascia as well, and all the different components. It's like it's a very complex system, and you can't take one away because and just look at the other, thinking that this doesn't play a part because the whole body is just constantly learning, as you said before.
This is
Uh,
this this is one of the biggest challenges that I see with society as a whole.
yeah,
And again, this is why I try not to do it myself and I try to be aware of it, is pigeonholing ourselves because everybody wants a specialist, right? Everyone wants that oh, I go to a fascial specialist, or I
yeah,
go to this specialist or that specialist. That's fine. There's nothing against specializing, but who's the person that's overseeing your care? Because if it's just the fascial specialist,
right,
maybe they're missing something. If it's just this person, maybe they're missing something. So having a team approach or having somebody, and that's where obviously I'm biased, but I
yeah,
think that a doctorate in physical therapy, which connects, you know, um, strength and conditioning, it connects manual therapy, it connects knowledge of anatomy, physiology, pathophysiology, pharmacology, radiology. To me, our profession has the most diverse and covered. Doesn't mean we can treat everything, but we have the best position to be for an umbrella role.
Yeah, I think that's amazing. Just that, yeah, just your guys' perspective. It sounds like what you guys are practicing just really much broader scope and more like what, at the end of the day, what's going to work best for clients and how do we get them there?
Absolutely.
Um, yeah, it's just very refreshing because I've seen a lot of people after physical therapy, and I think I told you I did a lot of observations. I thought I was gonna be a physical therapist at the time, and I'm excited that this is where you guys are going with it.
Yeah.
Um, So I wanted to go back a little bit is you talked about how what people are told they can do or can't do. And there's also like her bulging disc changed,
Hmm.
um, or herniated disc, sorry. But like the idea of if you took out all the things that people are supposed to do, Movnat, like you couldn't do any of the natural movements that we would need to survive. Like that's one of the things I love about Movnat is like not even Erwin Lacour's books, like not even recent changes in society, but like 10,000 years ago, we started farming. That already changed our movement variety.
Yeah.
Uh, and everyone's talking about like now the computer technology. He's talking 10,000 years ago. And it's like all the things that we couldn't do because you might hurt something. It's like we wouldn't, all the natural movements would be out, or many of them.
Yeah.
So, can you I guess that's just one thing I wanted to add there, but the idea of like things changing. There's starting to be research, I believe, about like cartilage regrowing in knees when we take away the irritation. Seeing X-rays of people who've done the Agoski method 1 year apart, and they're like, "Oh, there's space there. The cartilage is regrowing." A lot of times, it's like, "Well, I have a herniated disc. I have bone-on-bone joint degeneration. I'm old, whatever it is, like this is where I'm at. Like, what is your belief about the body's ability to heal and all of that long term, not just movement quality, but regeneration and stuff?
I love comparing this to quantum physics. And let's just go all the
Yeah,
way there.
yeah,
Um, because well, not just quantum physics, but
yeah.
our knowledge base in general, as a human species.
Hmm.
And there's two things that we constantly look for, and that's growth, right? And we look to make sure that we're right, right? We're looking for certainty and we're looking for growth. And so
Yeah.
we think that we're constantly getting bigger, better, stronger, smarter, things along those lines. But we have to be careful that that's not always better, or that's not always the direction that we want to go in. It's
Hmm.
number one. And then number two, just thinking about um, what really is important for us.
Hmm.
What really is, you're right, the best for us. There's so much that we think is the right answer, right? We thought the Earth was the center of the universe. We thought, the Milky Way was as far as it goes. We thought this was as far. So things keep changing in science alone. And
Yeah.
so why would we not apply that to the human body? So again, we know a lot, but do we know everything? Absolutely not. Is there going to be new data 10 years from now that, my interns are going to be teaching me? Probably, absolutely, at some point. And I hope so. I want them to be coming out with new information. And we just have to think again. That's why it goes back to making the decision with purpose and with precision. If you're really giving yourself time to think about it, oh, I can't do that. Okay, great. Let's talk about that. Why not? Well, because I'm afraid. Oh, okay. That's the reason why. Okay, that makes sense. Oh, because my knee is going to do this. Oh, what makes you think that? So if we can open up a conversation about this,
Yeah.
and again, not just like, I know you can, I know you can, I know that, I know, I've seen you do this, and I know you can do that. I never say that to people. I say, based on my physical evaluation, I feel extremely confident that you're going to do this, and that it won't hurt you. Can I guarantee that? No, I can't. I can't give you that guarantee. This is a human body that we're working. This is not a 2x4 or a screw or something else. Even that, I'm sure there's not 100% certainty. But this is human engineering, and there is an emotional component. And I think that I know you well enough to know that you'll be okay. But absolutely anything could happen. And how does that make you feel? They're like, okay, I feel better. I'm willing to give it a shot. I'm a little nervous. Sure, be nervous. I don't want you to be, just drop your feelings and emotions.
Yeah.
Um, but like you said, keeping an open mind to what we don't know, and then allowing that to go back to, again, do I know, is CrossFit good for people to do? Yes, it's better than nothing. Yes, it's better than just going to the gym and doing, a bodybuilding program. I believe it's more diverse, more functional. But are there certain components that are missing from it? Absolutely. Do I think yoga is good for you? Absolutely. Do I think these things are all good? But if I was going to go 50 years, what would I pick? It's Movnat. It's natural movement. Nothing gets me the most diversity across all those boards between strength, mobility, neurocognitive learning. 100%, and feeling excited to do the workout. When I just put up a pull-up bar about a year ago in my backyard, and man, I am literally looking forward to the next day when I get to climb and move over it and balance on it and a whole bunch of different things.
I was gonna say,
Um,
is that the same pull-up bar that I see you walking
yeah,
across trying? Yeah, that's
it's 7 feet long, 7 or 8 feet long. So again, it gives me so much. It's not like I'm just going out and work on this one thing. It's like, oh,
yeah.
I don't know, maybe we'll hang this way, some leg hooks, some reverses. Maybe I'll hold for time. Maybe I'll balance on it. So, but the point is that I don't know which one of those is the best. Again, in society, we try to find the best one, and let me do that. What's the best? That's the best. Okay, I'm going to do it, and everyone's going to do it. But that's the best for who, right?
Right.
And so MoveNat gives you so many regressions and progressions and variability that you can find what works for you. And you can find, but bottom line, as a human being, we know you need this stuff. So yeah,
Yeah, and I'm sure I'll learn more as I go through because the Movnat Medical course in December, that's gonna be the first Movnat training. I was debating whether to do level 1 or the Movnat Medical. I feel like Movnat Medical is gonna be a good for what we type of population we see initially and
yeah,
then expand it. But one of the things that I think is interesting is, like, the workouts when they're written, I think some of the mobility ones were 20 exercises in, I think, 15 minutes.
right.
And so it's not like many of the times we go to the gym, it's like we talk about needing more movement, but it's like we're doing repetitive. Even if you do 6 exercises, very repetitive sets of 10 over and over. Whereas you might be doing a side bend sit, getting a reach in, and then you're turning. You do reaches twice each side, then you're turning. It's
Yeah,
like the amount of variability you're getting in your body and the fascial system and the muscles. Like this isn't a one muscle group thing. When you turn and look over your shoulder, you're getting muscles in the hip to stabilize all of it. And I think that's, like you said, that variety and the, like, I would say boredom goes away with that.
yeah.
Um, just something I've really enjoyed with that part.
And yeah, and this is Brian. I mean, you tell me, Brian, this is what blows my mind, right? Like you and I are sitting here, we're
Mhm.
doing it, and we just get this feeling of like, ah, that was, and you can drop stuff into your workout. You can have a specific workout program, and then you
Mhm.
could deviate from it a little bit and add something on and things along those lines, or you could stick with the program, 100%. Um,
Mhm.
but at the end, you get that, oh, that was fun. That was interesting. Like, oh, I just did something a little different. But yet, society keeps pulling back. And I'm going to bring up that point again to the specialist, right? Like, oh, well, Brian, if you want to work on mobility, why don't you just take a yoga class, my man?
Mhm.
And like that statement isn't wrong, but the question is wrong, right?
Yeah.
Like, you know what I'm saying? So, I mean, how do you address that? This
So,
specialization.
yeah, I mean, yoga, I think yoga is a great system. Um, it's like, but how does our body show up to the yoga? Like, what body are we bringing into it? So if someone's doing a forward, like they're standing on one leg, holding the other foot, but their spine's crunched to one side because they don't have the range of motion. It's like, what's the effect of that? Like, we take pictures before and after, we gauge balance when we're done. And just to like when working with someone, it's like we're never treating the condition or what's going on. It's like pain-free range of motion, and then we work with posture. How is the body organized? So sometimes we'll do an exercise, and it's like that could be the best exercise for your friend, but for you, you're now stuck onto one side, and you can't get back in from the right to the left. And so it's like we don't have a specific protocol. It's
Good.
what works for your body? How do we get that base solid and then expand from there where everything should feed into better movement, more vitality. It's like if something you do starts bothering your back, it's like, well, that's not for you right now.
Yeah.
We'll expand when you're ready and your body supports that. We'll explore it. So I don't know if that quite answered it, but
Yes, because
yeah,
it hit on the most important thing, and this is what, again, I'm lucky to be in a place where I can do this, and
yep,
Movnat has helped to spark it as well, 100%. And again, I push all of anyone that I'm training or that's working with me to make sure that they're thinking about why they're doing something. Because
yeah,
if you can tell me the reason why, that's a whole different conversation. I don't want to just say, "Oh, we're doing this." Okay, is that right or wrong? Yeah, that works. Okay. I want to know why. I want to know what's your goal, because you might say one of your clients might say, "Well, I want to do that activity." Why? Well, because my friend can, and it bothers me that they can and I can't do it, so I just want to work towards that. That's a perfectly valid reason,
yeah,
right? But if they're doing it because they think that it'll help their hamstring mobility, and you're like, oh, it actually has nothing to do with your hamstrings.
right.
If you want to hit, let's explore this. So again, being less specialized and having more in your toolbox. Again, the Movnat Medical course is fantastic, and I caught myself where I go way over on time. And sometimes I'm always nervous. Oh, we're going to be done early, and everyone's going to be disappointed that we're finishing early. And it never does, because, again, there's just so much that we can explore into. And the more that you have at your disposal, whether you're a patient or a doctor, whether you're the client or the trainer, the more that you have at your disposal,
Mhm.
the more capable of a human being you're going to be, and the more that you're going to be able to help yourself and help others. So that's again one of the biggest pulls that I've seen with the system, is to be able to use different things like you keep talking about outside the five normal exercises, challenge people, connect with what's important for them, and give them something to learn, versus just the specialization. Again, not that specializations are ever not necessary, but to make
Yeah,
sure that you're using that appropriately,
mhm.
and not just
Yeah,
throwing it at everybody.
yeah. It's like we were sometimes people come with shoulder issues, and it's like the shoulders. It's like the scapula moves on the spine, moves on the rib cage, and it's like if your rib cage is off, if your spine position's off, which are affected by the hip position. It's like all of those are going to affect your ability to use the muscles in the shoulders and chest, as well as pecs and
Yeah.
upper and lower traps and all of that. It's like, what if the best exercise for your shoulder is a hip exercise? And so
Hmm.
we never stop, or not everybody, but it's like so often it's like, well, this is where the pain is. Let's zoom in there and forget everything else.
Yeah.
It's like,
Yeah.
how
Super interesting. Yeah.
so it seems like you guys have had some incredible stories and just introducing natural movement, which I love the confidence building. There's an excitement to it because you're exploring like different ranges and stuff. What would you tell somebody that's like, it hurts to walk up and down the stairs, like my knees hurt, my hip is off,
Yeah.
um, and they're like, I want to get into natural movement or I want to get better and heal my body. Like, what are some of the principles and steps that you'd walk them through and to the point where they can go do whatever they want in their life again.
Yeah. Well, that's the biggest challenge, right? Is they don't know where to go, and nobody, like, who would give them the answer to that.
Mhm.
Um, the physical, most a typical physical therapist might just look at it as your knee, and oh well, I'll stretch your quads, stretch your hamstrings, do a little ultrasound, and send you on your way. But finding somebody who's capable, again, whether it's an MCT, MoveNet certified trainer, or a doctor of physical therapist who's also an MCT, but find somebody who's really willing to work with you to answer that question, to say, what can we do to build up to that point? And that will give you a specific answer, not
Mhm.
just build up your strength. It can't be that general. It cannot be that general. Even when it is that general, the answer is still more specific. You know what I'm saying? Like, even when the answer is yes, we need to build up your strength so that it takes pressure off of the joint. Yes, but which muscles? How?
Mhm.
Why? How often? What do they need to do to contribute? The answer has to have a lot more to it. So I challenge everybody to find someone that's the only way, because you're not going to be able to find the answers yourself. We all need that support. But
Hmm.
finding someone who's willing to give you a very complete, comprehensive answer. And I love when patients challenge me. Oh, well, what about this? I heard this is good. Great, bring it. Come on, bring more questions. A lot of times those are deemed the difficult patients. Those are my favorite.
Yeah,
I
mine
love that.
too.
Great, you're doing research. Good. What have you heard about that? Yes, that is 100% correct. But in your case, you have this. So if you had more thoracic mobility, then you should be doing that. But because you don't have the thoracic extension, you're just going to impinge your shoulder over and over again if you do that. And then they're like, oh, okay. You see how we connected over it? It wasn't just, no, that'll cause you a problem. Yeah, find somebody who's going to answer your questions thoroughly and help you to work through it. So, because again, the Movnat system has so many regressions and it builds upon itself no different than when you were a child. We
Mhm.
spiral down, we've accepted in society a spiraling decline throughout your life.
Mhm.
And you can accept that or you cannot accept that. Does that mean you'll be doing pull ups when you're 85? Maybe, maybe not. I can't guarantee any of that. But to say that you can't and that's never going to happen, I don't agree with that.
Yeah,
The Another quote that I love is, "I plan to live forever. So far, I'm right."
yeah, it's
And
good.
I apologize. I don't recall who said it or where I found it, but I just thought the same thing. Like I plan to be able to move the same way that I am now in 20 or 30 years. So far, I'm right, and it's working. And we'll see what happens. I'm sure I'll have to make changes along the way. But if I can have that fluidity in my brain, and my cognition, if I can be aware of why I'm feeling certain things, and if I do lose one or two skills, is that going to make me feel incompetent? Is that going to make me feel like I can't teach people anymore? Is that going to make me feel like I can't help my patients as much? I have to process that stuff and understand that, and then decide which path I want to continue on. No different than how I do that with my patients and their movement patterns, what they're able to do, combine the best evaluation skills with this listening, interpersonal neurobiology, and the variety that Movnat provides.
Yeah, yeah, that's exciting. I'm 32 now, so it happens less. But like 25, I'm like, hey, you can do this with your body, you can heal it. And they're like, yeah, just wait till you're 50. And it's like, awesome. So now I have to wait till I'm 50 to be like, hey, no, it happens.
It
Um,
works. Exactly.
yeah. So there's a Qigong master who's, I like to show his video. He's 118 years old, maybe 116 when they recorded the video. And he's just doing these fluid dynamic motions where he's picking his leg up, kicking, and like holding it, and then does like a deep lunge. And
Nice.
like just the fluidity, the balance and control of someone who's 116. It's like I like that as my reference points. Like you said, that fluidity, that view,
Yeah.
because if it's possible for one person, it should be possible for more. Instead of looking at what's normal, like what's possible. And yeah,
Exactly. You have to ask that question. You're absolutely right. It's just like time management, right? You have time for nothing. People say, "Oh, I don't have time for that." No, no, no. You don't have time for things. You have time, and that's it. And so the same thing with our movement patterns. It will cost you something.
yeah,
You've got to get your butt up and go to stretch class, to your movement class, to something else. You have to be you have to be comfortable being uncomfortable, going to an environment that maybe you don't feel is right for you, but it probably is. And you have to step outside that comfort zone. So that's going to cost you something, but you'll gain those movement competencies. Or you might have to practice it on your own, or you might have to spend money. Again, I think it's $200 for the e-courses that Movnat Order offers. I think those are the best thing that you can buy because you have them forever and keep going back to them. So you have to agree that I'm going to spend $200 on keeping myself more mobile. I'm going to try it. It might not work, but it might work. So you have to make, people have to make those decisions when they're 50, 55, 60, but then they also need to find somebody to help them. Because if you do it on your own, more likely to get hurt or more likely to just get stuck mentally and say, I don't know, should I push forward? Should I not? And again, that's where I helped Denise. And again, I think of her low back. And she, by the way, she did tripod vaults over a 24-inch box.
oh,
And
that's
one day her grandkids, she was watching her grandkids and she had to bring them with her. And she's like, watch Nana, watch Nana. And I'm like, this is so great. She's Nana and she's doing
yeah,
tripod vaults over a
that,
24-inch box. And she was like, no way, Phil, no way, no way. and she just gets right down, puts the leg through, and she's still, complete disclosure, she still has total distrust in herself.
Hmm.
But I mean, we've done it, over and over several times, and so it's so nice to see her doing that and feeling that. So yeah,
Yeah. Compared to like, she's the one that didn't want to rotate, right?
yeah, exactly.
Yeah. Such a huge transition.
Yeah,
I want to just a quick moment because one of my challenges is like, we'll get people moving better, they're feeling progress, and then it's like, well, now I need strength.
yeah,
And you mentioned the idea of like, you need strength, and it's like the ground-based get-ups and the ground movements where you're finding ways off the ground. Like, I know that for this gentleman, like that's really what he wants, like the strength to get up and down off the ground. But he's
yeah.
doing like squats to a chair, which can have value. But like, what's your view of strength versus like mobility? Or I haven't articulated what that difference is, but it's like most people want to do all the Movnat stuff for the rest of their life, but our mode is strength. Like that's what we need. And
Yeah.
can you share a little bit about that?
Yeah, well, there's two things I could say. Is number one, I always talk about this because I really feel as a society we're stuck on this 1970s, 1980s bodybuilding fitness model. We see that, we see other people doing that, and we think that's the answer.
Yeah.
But really realizing that there is so much more than just going to the gym and lifting weights or doing, again, nothing wrong with that. And that will work to achieve certain goals. But the thought process that everyone should do that and that's the right thing for everybody, well, it's good and it's doing something, but it's not the answer for you. That's where I think the strength paradigm comes from, is that bodybuilders took over and we said, oh, well, he's strong. If I want to get strong, I'll do what he's doing,
Yeah.
but not realizing he's doing it for the purpose of, you know, winning this competition. Oh, okay. That has nothing to do with what I'm doing. And then, really saying, what else can I do? And again, maybe it is bodybuilding. Maybe, strength training at the gym is what you should be doing. But if your goal is something different, I just encourage you to explore that. That's number one. Number two, my own personal experience. Again, I told you in high school, I couldn't touch my toes.
Mhm.
Ever since I've started working on that more and more, working towards the pistol squat, working towards other hip mobility, using step unders, step overs, step ups at higher steps, like simple stuff that we talk about in Movnat, but nobody does at the gym. No one's doing step unders at the gym ever, I think. I don't think I've ever seen anybody. But that has included, guess what? Drum roll, please. Lo and behold, my abdominals are getting stronger. Whoa, who would have thought about it? But it
Yeah.
completely makes sense as I'm getting more lumbar flexion and more pelvic flexion, that my abdominals are kicking in more and they're learning how to activate. And this through motor learning. This is motor learning. This is not strength training. This is motor learning. So, if you're aware of what you want to do and what you want to accomplish, and if it's strength, I'm talking to my 13-year-old right now. He's starting to get into working out and he sees his friends doing it. I said, okay, what if we try this? What if we try this? And I'm trying to really, really share that with him, that his mobility is the most important thing. I'd rather him have a lightweight, and of course we use several
Yeah.
rocks outside and trees that have down, but just use that and get, like you were saying, 100%, get up and down off the ground, go into a very deep squat. If you occasionally want to grab the heavier weight and go partial range, that's totally fine. But if
Yeah.
that's your main goal, well, what's the pressure it's putting on? What are you learning today? How much are you balancing that? It's just like eating some candy, right? There's nothing wrong with that. But if you do it all the time, it's going to have some negative effects that you're against what your goals are.
Yeah, that's amazing. And I love the intention, the question of the intention,
Sure.
because like made a video yesterday. It's like people get frustrated with me because my answer is it depends.
Yes,
So,
absolutely.
well, what do you want to do it for? And then also, what status is your body in? And
Yes,
you directing is like, well, what's your goal? Like that could be great for a bodybuilder or a cyclist or a yogi. What do you want to do with it? So
that's
that's
right.
so we are about out of time. So I wanted to, is there anything about the physical therapy that you're doing, the Movnat Medical, or in general that you'd like to share with people?
Yeah, mostly the Movnat Medical course, and again, that's where I get to share with people what I'm doing as a doctor of physical therapy. The course just really is designed to do two things. Number one, teach all of the Movnat skills that are necessary to bring into the clinic or that have been most helpful.
Mm.
Again, keep in mind, it's not just me that's making the curriculum. There are 15 medical clinicians around the world, from Spain to Canada, North America, South America, Brazil, all over, that are helping out and contributing to this based on their experiences. So you're going to learn, number one, all the skills, but more importantly, well, maybe not more importantly, but equally importantly, is how to integrate it through the clinical decision making, right? All these continuing ed courses will teach you all these mobilizations or all this assessment skills, but the actual thinking of how do you see that? Oh, Phil, what made you choose that? I love when we spend the second half of the second day doing all case studies. And I like when they give me case studies to start. And I say this. And they're like, man, and like, what else? And I'm like, this. And I can just ramble off so many things that I think are helpful and why. And so then have them do their case studies. And I said, that's, just to see them lighting up and see it clicking and see them understanding how to integrate it and to get what would normally be, A, B, and C goals, whether you're prone doing hip extension versus prone and rolling so that you're getting hip extension, knee flexion, and lumbar rotation. Like, just to see them connect those points and to see how they work together, but have more benefit to them. That really is the highlight of the whole course for me. And again, it allows me to share not just the skills, but why I decide to use it, which is, equally important. Yeah.
Yeah, I'm super excited. So yeah, it's in December, the one in Richmond. I was like, oh, there's one actually like an hour away. It's an hour, 90 minutes for us. And so I'm going to spend 2 days with you getting to learn all of the Movnat Medical and how to apply it.
Yeah.
Is there a place that you'd like to direct people either to either the private practice in New Jersey or Movnat Medical or both?
Yeah.
That way.
If anybody has any questions, they can contact me directly via email, which is just phil@movnat.com. The New Jersey Center of Physical Therapy, feel free to check out our website. And, we have a lot of student internships. So if anybody's in that role, they're in PT school and they want to come up, feel free to reach out to me. We can help you set that up. And then, like you said, December in Richmond, Virginia. I believe the class is either half or 3/4 of the way full. So there's still a couple spots still left. But just the momentum, each course has been building and building, and the course has been getting better and better because we tweak it just a little bit. But that's going to be the last one on the East Coast, because then I'm getting pulled to Canada, and Europe is like, when is it coming to Europe? When's it coming to Europe? So I'm like, okay, we'll go to Europe in 2023. But like you said, in addition to running the practice and my family and everything else, there's really only going to be 2 or 3 courses a year. So if anybody's on the fence, jump on board, and I hope to see you there.
Yeah. Well, thank you, Dr. Phil. Really appreciate you being on the call and the difference in how you're approaching physical therapy. Like, I don't know whether I'll go back and get a doctor in physical therapy, but it makes me excited about what you're doing with it and where you're going. Yeah, the patient care, their focus on them and what they need. So thank you so much for being on the show today.
Pleasure, Brian. Thanks for having me.
Thank you.